I hope the screen is visible.
Yes, sir. I
Will-
request our participants to be muted and use the chat.
So let me know if the screen, there is any problem with the presentation. Okay.
Sure, sir.
So good evening, everyone. Uh, when we think about the advanced medical technology, we often think of laser, robotics, etc. But today we are discussing a biological marvel that has survived the test of time for over 5,000 years. That is the medical leech or jalauka. So jalaukavacharana is considered to be the most refined method of raktamokshana. It is not just about removing blood. It is a precise delivery of a complex biochemical cocktail which include hirudin, kallin, vasodilators, hyaluronidase, and many more, which are directly injected into the microcirculation. So today we are exploring how this legendary therapy is going to solve modern clinical challenges. So we all know the Samudra Mantana, Lord Dhanvantari emerges with Shankha, Chakra, Amrita Kalasha, and Jaloka. Why do you think would a divine entity or a divine being at his very manifestation would choose to hold a worm? It is said that nature's tools are the highest form of technology. Jaloka represents one such, and it is the supremacy of biological intelligence. Now, in the world where every other bite, whether it is a predator, if it is a venomous snake or an insect, or even a human's mouth, which is filled with bacteria, is said to be a source of trauma, hazard, or infection. Jalauka is a creature in the animal kingdom whose attack is actually an act of healing. Where other insects injects venom into the body to destroy, Jaloka is engineered to inject life-saving pharmacy to restore health. So think about this irony where we spend billions on synthesizing anticoagulants in labs, yet Lord Dhanvantari emerged from the oceans thousands of years ago with a living device which does this better, safer, and more intelligently than any other device human have ever designed. Now, when we see in the Sushruta Samhita, which is the oldest ever surgical manual, Acharya Sushruta dedicates an entire chapter in Sutrasthana for the study of Jaloka or leeches. It wasn't just a brief mentioning, it is a comprehensive manual considering or covering identification, harvesting, conservation, classification, Purva, Pradhana, Paschat Karma. Acharya Shushruta not just saw this Jaloka as a worm, but as a living surgical device. Now, why this treatment is unique? When we see into the indications, Raktamokshana is performed using different tools based on the condition as well as patient's tolerance. On one hand, we have Siraveda, Prachanna, which are painful. Though Shringa and Alabu are milder in nature, Jaloka is said to be the gentlest of the gentle, especially recommended for Paramasukumaras. Drupa and Adya, which are the royal and elite class who demand comfort and aesthetic care. Then for the Bala children, Stavira, who are old aged, Biru, who is anxious of any sharp instruments, Durbala, who are weak, Nari, women, and Sukumara, who are sensitive peoples. Now, coming to the indications of different instruments as per the doshas. So, for Vata, it is Shringa due to its Snigdha guna. For Pitta, it is Jaloka due to its Shita guna. And for Kapha, it is Alabu due to its Ruksha guna and Ushna guna. Now, here, when we see into the Nirukti, there are two aspects Acharya have highlighted. Jala is considered as Ayu as well as Jala as a Oka. So when we go deep into this, Those whose very life or ayu is jala is considered as jalayuka or jaloka. This highlights the biological dependency. A leech cannot survive, breathe, or remain medically active without moisture. In clinical practice, this reminds us that the potency of the leech depends on the quality of water you keep it in. If the water is impure, the ayu of the jaloka is compromised, making it servitia or toxic or inefficient. Now, coming to the second part, that jaloka, the jala as oka of jaloka. Here, the oka means dwelling place or the habitat of that jaloka. So, this explains why in Purva Karma, so this explains that why in Purva Karma, Acharya have said that to keep it in a earthen pot with fresh water and aquatic plants. Uh, to get the best results, a physician must replicate this home environment for the jalokas at his clinic or at his home so that they are comfortable and not agitated. If you want to have this legendary tool effectively, you must replicate or you must respect its nature, and you cannot treat jaloka as any other stainless steel surgical instrument that you throw into the tray after use. You must treat it with utmost care and hospitality as much as your own pet. Only a hydrated, healthy, and a happy leech would provide the best form of healing saliva required for a successful treatment or a procedure. So, when we see into the classifications, we have Sarvisha Jaloka and Nirvisha Jaloka. So, there are 6 types of Sarvisha Jaloka, 6 types of Nirvisha Jaloka, who are being named as per the morphology and the characteristics. In Sarvisha, we have Krishna, Karbura, Alagarda, Indrayuda, Samudrika, and Gochandana. Whereas in Nirvisha Jaloka, we have Kapila, Pingala, Shankamukhi, Mushika, Pundarika, Mukhi, and Savarika. So let's see a brief understanding of how these are. So Krishna is Anjana Churna Varna. It is blackish in color, and it has a distorted, broader head with a Prutu Shira, and it is having a Krishna Mukha. Then coming to Karbura, it is like a Varmi Matsya or something like an eel, slender and long, and it has Chinnonata Kukshi. It has a elevated belly. Alagarda is Saroma or Romashaha, which is having hairy. It is hairy and it has Mahaparshva. It is again Krishnamukha. Indrayuda is one among the beautiful looking jaloka, which is similar to like a rainbow colored jaloka, but the most dangerous one. Samudrika has blackish yellow patterns and also certain patterns which resembles flower on the body. And lastly, the Gochandana has a narrow mouth with the body resembling Go Vrishana. So that is why the name Gochandana. Now, what happens if a Sarvisha Jaloka bites? We can expect symptoms like Atimatra Swayatu, Kandu, Murcha, Jwara, Daha, Chardi, Mada, and Sadana. So these are typical toxic symptoms what we can expect in any toxic animal or reptile bite. For this, the treatment is an antidote mentioned by Acharya Sushruta is Mahagada, which is mentioned in Kalpasthana in Sarpadashta Visha Chikitsa, which contains drugs or herbs like Trivrit, Vishalya, Madhuka, Haridra, Manjishta, and Kritamala. Now coming to Asadhya, if bitten by Indrayuda, the colorful one, it is said to be Asadhya or fatal. Now let us see some of the classification of Nirvisha Jaloka, where Kapila is the most commonly used one, which is having Manashila Varna on the sides, and it is Snigdha and Mudga Varna. It is slightly greenish in color. Pingala is reddish brown in color. It has a cylindrical body, and it is swift in its movement. Shankamukhi is Yakrut Varna, and its mouth resembles conch shell, so it is having a sharp mouth as well as it is shigrapayani. It can suck blood very rapidly. Mushika has Akriti, Varna, and Anishtagandha as similar to that of Mushika. That is why the name Mushika. Pundarikamuki is again Mudga Varna and it has a mouth which resembles bloomed lotus. That is why Pundarikamuki. And Savarika. Savarika is the one of the biggest ones among the Nirvisha Jaloka, which is Snigdha Padmapatra Varna, which is slightly dark green in color. And it is again more than Ashtadasha Angula Pramana. It is bigger ones, particularly used for animals or cattle for Rakta Mokshana. So these are the classification and different types of jalokas which are there in nature. Now, where do we find this? It is said that a leech is only as pure as the water it swims in. For the best medical leeches, these are found in clean fresh water enriched with decomposed stems of aquatic plants like Padma, Utpala, Nalina, Kumuda, Pundarika, etc. So these plants are Shetavirya and have anti-inflammatory qualities. So as these stems decompose, they release phytonutrients into the water and which the leeches absorb. This naturally pre-medicates the leech, making the saliva even more potent for treating pitta and rakta disorders. Now coming to the geography part, Acharya Shushruta identifies these certain specific regions where you can find the most potent Nirvisha Jalokas. For example, Yavana, that is corresponding to the ancient Turkey and Middle East. Dakshinapata is Deccan Plateau in the southern India between the western and eastern Ghats. Then Pautana is fertile lands of surrounding the Mathura and mountain ranges where there is cold, mineral-rich running water. These places, you can find these Nirvisha Jalokas, which are safe to use, but also most biologically superior ones. Now, coming to the Savisha Jaloka, they live in an environment of decay. So, Savisha Jaloka typically are found in vitiated or impure water bodies. Sushruta describes them in the origin of water, which has been contaminated with urine and feces of venomous aquatic animals like toxic toads, snakes, insects, etc. So they are found in kalushita, stagnant, dark, muddy water or a pond where the water doesn't circulate. And also the ahara, they feed on kleda, which is the putrefied matter of dead animals and toxic algae, etc., due to which the saliva of these leeches become the carrier of toxins rather than healing enzymes. Instead of being a biological pharmacy, they become biological hazards. Now, coming to collection of leech, then maintaining and preservation. So leech collection is particularly usually done in Sharad Ritu. And there were ancient practices where two clever bait methods were used to catch leech without harming themselves, unlike the one which you are seeing in this video. One was the wet leather method, where a piece of fresh wet leather was placed in the edge of the pond, and the leech used to get attracted. They used to cling to it, and they were carefully gathered. Then there was a pitcher method where large earthen pitchers were or pots were filled with pond water dipped into the pool, and to attract leeches, dry meat powder or aquatic bulbs like lotus roots, etc. They were placed into the bait. Once the leech enters the pitcher, they are carefully retrieved. After collection, the maintenance, there are SOPs for storage, which has been detailedly explained by Acharya Shushruta. So leeches are living organisms. For its best clinical efficacy, it always depends on how you keep it. So the habitat, food, and hygiene part, where the habitat has been explained, large earthen pots or gata, which has been filled with clean, fresh water. Then for food, it is you can add fresh water algae or aquatic plants where it provides a natural environment and nutrition. And coming to hygiene, which is very important, where the water must be changed on every third day to prevent buildup of toxins and to ensure oxygenation. And the pitcher itself should be cleaned or it should be changed on every week so that it can prevent slime or bacterial growth in the walls of the pot. However, in our modern clinical practice, we use glass jars and plastic containers, but the principle remains the same. So, fresh water change every third day and cleaning the container thoroughly on every seventh day. So, if you neglect this hygiene, your leeches might lose their virya and also might die. So, they are very sensitive. So it is said that a good Vaidya is first a good caretaker of his own tools. So that is why I have highlighted this. Now, this is a certain ecosystem what we have tried to recreate so that the leeches are comfortable and not agitated, something like a pond what we create. So you can see over here. Now coming to the main part, the process of jalaukavacharana, where there are certain methods which have been, Acharya has been explained, where Vigarshana has been explained with Mrittika and Gomaya Churna over the lesion so that there are small aberrations which have been created so that leech can easily catch hold or latch on that area. And coming to the activation part, it has been placed in water mixed with Sashapa and Haridra Kalka. This stimulation awakens the leech, making it active and ready to bite. Now, the activated leech is applied directly over the affected site, and to keep it comfortable and active during the session, it must be covered with a wet cotton gauze and or a pad so that the temperature is under control. So if the leech hesitates to bite, a drop of milk or a tiny prick to draw a drop of blood can be used to encourage the leech to latch on. Even after all these aids, the leech refuses to hold on, then it is considered sluggish or unfit for the session and should be replaced with a fresh active one. So this is a turmeric bath, what we can do. And this turmeric bath is like a pre-op prep for these microsurgeons, just like a surgeon who follows a sterile protocol before going for any surgery. So it not just purifies or disinfects the leeches, but it irritates them just enough to make them seek the host. Now, how do we know that the leech has held on to the site? So during this process, we see for different signs and symptoms where you can identify that leech is successfully drawing the vitiated blood or the dushta rakta. When there is the arching of the mouth, just like Ashwakuravat, where the horseshoe shape which is being taken by the mouth, and it lifts the shoulder with a rhythmic suction. And once the patient begins to feel the toda, pricking pain or itchiness, it is a clinical sign that the leech has started to feed on Shuddha Rakta and we have to cease the treatment or remove the leech from the affected place. So the concept of Dushta Rakta being sucked first is being backed by Hamsa Kshiranyaya. Now, in this video, you can observe all the signs, the Ashwakuravat, the arching of the leech and rhythmic peristaltic waves over the body, which confirms that it has successfully latched and it is actively pumping out Dushta Rakta. So you can see the leeches sucking and all the movements, what you see on the body. Now, there are certain precautions or cautions or contraindications which we need to know. Leech therapy or jalaukavacharana is usually preferred to be done in pratak kala so that leeches are comfortable. and avoid bony prominence. Then for kids below 2 years, do use one leech, and for adults you can use 6 to 10 leeches. Avoid vital areas like Sira, Netra Falaka, then Marmastana, Shishna, and Vrishana. And the primary risk involves the Aeromonas hydrophila bacteria, which is said to be living symbiotically in the leech gut and in the ponds of leech where the leeches are living. So this can cause localized or systemic infection, especially in immunocompromised patients and those with HIV infections. So there is strict contraindications for patients with bleeding disorders, just like hemophilia and leukemia, and those with oral and IV anticoagulant therapy. It is totally contraindicated, or you have to keep them weaned from the therapy for a few days, and then you can go for leech therapy. As leech has hirudin, which is a natural hirudin, which is an anticoagulant, so it will trigger uncontrolled bleeding. So it will be difficult to stop the bleed. So that is why who are on this therapy, anticoagulant therapy, you need to ask them priorly before doing leech therapy. Additionally, you have to avoid this therapy for ones who are physically depletion, who are into physical depletion such as cachexia, hypotension, septic disorders, etc. And also in whom where the blood flow is totally compromised, like in arterial insufficiency, you have to avoid leech therapy. And special care and expert supervision is required for when you are doing it on children, pregnant women, lactating women, and in cavities like oral cavity, in anal region. So they have to be in supervision while this process is being done. And also take care when the patient is having some advanced hepatobiliary diseases. The body may not manage the hemodynamic changes as well as the lead salivary enzymes effectively. So you have to take special care in these cases. Now coming to Paschat Karma for Jaloka. Vamana is done, so inducing Vamana through Haridra Churna and gentle massage or strokes over the body from the tail to the mouth to ensure complete expulsion of ingested toxic blood. While strict precaution must be taken not to squeeze too hard so that you might cause injury, internal injury, and even death. If these leech might die. So once leeches are totally empty, place them in place these leeches in a fresh container with a clean water, quarantined or isolated from any other unused leeches. If at all the leech sink or they are motionless, they are not active after this Vamana, then the Vamana is either incomplete or too aggressive. So either the way the leech becomes fatigued and they might die. And a well rested, well vomited leech can be reused after a rejuvenation period or a resting period of 7 days. And in Indramada is a asadhya vyadhi of Jaloka, where due to Durvanta, it might die eventually. So that is called as Indramada. Now, Paschat Karma for the patient. So after Samyak Srava, Abhyanga with Shatadotagrata or Madhudarshana followed by Shita Jala Parisheka is being explained. Or you can go for Kashaya Madhura Snigdha Shita Pradeha after the over the wound and bandage it. Now let us see certain clinical scenarios where and all you can go for jalaukavacharana. This is the most common mukhadushika where in acne or pimples where there is the rakta and pitta dushti, you can go for jalaukavacharana if the patient agrees, because there will be a small scar for a few days. So you have to make them understand that this will be there for a few days. And better use smaller leeches when you use for face. And you can observe here the size of the leech. They are very small. And once the leech grow in size after feeding with Dushta Rakta, you can see they go up to 3 times their size. Now here there are two cases where the first one is folliculitis in the inner side of the thigh, and second one is a perianal abscess. So these are Vranashoka basically. So in the management of Vranashoka, timing is important. So jalaukavacharana is more effective in during the initial stage, the amavastha or pachamanavastha. So by removing the dushtarakta early, leeches effectively arrest the progress of this inflammation. They prevent the lesion from reaching the pakvavastha or the complete huge abscess formation or pus pockets formation, or where there is too much of tissue destruction. So in these sensitive areas like perineal region or perianal region or a groin region, uh, Jaloka's biological suction relieves the internal tissue tension instantly, and it provides an immediate relief from the characteristic pain like Toda, Veda, all the various different pains which have been explained in Pachamanavastha. And unlike the surgical incision and drainage, that IND, where it requires a wider opening for effective drainage and it might leave a bad scar, leeches perform microdebridement. It cleans the area from inside out with minimal tissue trauma, and has high aesthetic recovery, just like laparoscopic surgery. Now, this is one of the unique case where this is a female with uncontrolled diabetes who came with a complication of misdiagnosed infection leading to necrotizing fasciitis and sepsis. So there is kindly mute your. Okay. So, so this is necrotizing fasciitis, or it is also popularly known as flesh-eating disease. So, the delay caused deeper tissue destruction with a black thick scar, what you can see over there, which has been formed. Beneath that, there is liquefied subdermal necrosis. So, in this condition, a triple action intervention was planned, a multi-pronged Ayurveda surgical approach, where first the initial stage was jalaukavacharana, where leeches were applied in the twilight zone of infection, which is that the border of the dead tissue as well as the living tissue. So this is called as a twilight zone. So at this place, multiple leeches were applied. So this facilitated the active drainage of Dushta Rakta and inflammatory exudates, which have been fueling this inflammation and also which has been responsible for the spread of the necrosis. And the second stage where we this thick non-viable eschar or the dead tissue, which was excised carefully, and this allowed the evacuation of liquefied dead tissue, which by removing we have removed the nidus of infection. So you can see in the third picture where the flap has been lifted and there is uh, too much of liquefied pus which is there. Serosanguinous discharge also has been there, and the success of this treatment is visible through the Shodhana of the Vrana, where the Dushta Vrana Lakshanas, so you can see on the top, where there is Putipuya Mamsa Sirasnayu, and there is Dushta Shonita Srava. Then there are pockets of pus within the cavity, is surrounding inflammation, redness, and all these things. And there's too much of slough, what you can see there. And this gets transformed gradually into Shuddha Vrana, which you can see in the bottom third, where there is collapsed cavities, a clean red granulation wound bed. And the last picture shows you the final epithelialized wound with a stable scar. So here, the role of Jaloka. where we, by doing jalaukavacharana, we achieved what we call it as a biological decompression. As Jaloka has access to Avagada dosha, deeper doshas, so they drain the deep-seated toxins and impurities from there, and it improves local perfusion, where the where even the systemic antibiotics may not or may fail to reach due to damaged vessels. So by combining leach's enzymatic action as well as a careful surgical debridement, we successfully treated this life-threatening condition. What you see in the last image is not just a healed wound, but the limbs which has been saved from amputation through the wisdom of Acharya Shushruta applied on modern surgical emergency. Now, in case of a diabetic patient with cellulitis, so cellulitis is not just an infection, it is a spreading fire of inflammation. Due to poor circulation, what happens is the body's natural fire trucks, that are the WBCs and the antibodies, they cannot reach the site of infection, and leading to a rapid tissue destruction, and it might end up in a potential amputation. So what Jaloka Charnas does is, much like an army of firefighters, Jalokas penetrate this area where the blood flow has been stalled, and the leech extract the stagnant toxic blood, which is Dushta Rakta, which have been fueling this inflammation. So in this case of diabetic cellulitis, Jalaukavacharana not just drains the toxins, it also extinguishes the spreading inflammatory fire in the cellular level, restoring the microcirculation as well as helping for the successful saving of this limb, which was at the risk of amputation. Now we have two different cases over here, where the first one is diabetic foot ulcer, non-healing ulcer, which has a tough slough on it, and the second one is osteomyelitis, chronic osteomyelitis of calcaneum. So in both scenarios, the primary obstacle for healing is ischemia, or lack of blood flow, and there is a biofilm which covers the wound, which is a resistant bacterial layer, and the standard treatments often fail because the systemic medicine what we take may not reach the wound because of poor blood supply, and this is where the leeches provide mechanical as well as biochemical solution. When we come to the part of non-healing wound in diabetic wound specifically, in a diabetic patient, the blood flow is usually sluggish due to high blood glucose, and the microvessels are often blocked. The vacuum effect by the leech creates a negative pressure gradient. This physically pulls fresh, nutrition-rich and oxygenated blood into the starving wound edges. There is histamine-like substance and acetylcholine in the lead saliva, which are the potent vasodilators. These widen the tiny capillaries or blood vessels which have been constricted, and by this they restore life into these pale tissues which are at the risk of necrosis. So it helps to reduce localized edema, which is often a biggest barrier in skin cell regeneration in diabetic patients. So when it comes to osteomyelitis, the second condition, osteomyelitis itself is a notoriously difficult to treat condition, where there is infection which is hiding within the bone tissue, and it has been covered with a sequestrum, dead bone. So there is zero blood supply to this area. So what we are trying to achieve here is the enzymes like hyaluronidase, which is there in lead saliva, which what it does is it is a spreading factor, and it breaks down the tough connective tissue barrier gradually, allowing the other enzymes of the leech and also the patient's own immune cells to penetrate deep into these infected areas. So As I said before, in chronic wounds, there is a thick layer of fibrin mesh which has been trapping bacteria. So there are enzymes like hirudin and diastablase in lead saliva, which dissolve these microclots and fibrin layers effectively by cleaning the ulcer bed at a microscopic level. So what you can see in the first patient's second photo, there is a gradual microdebridement of this unhealthy tissue, which takes place after jalaukavacharana. So where in these cases, surgical debridement will be much more painful because of it's a bony area and there is no much elasticity in this area. So that is why this can be a most comfortable way of uh, making the Dushtavrana into Shuddha. So, having said all this, we need to understand that Jalokavacharana is not just a standalone intervention in these complex conditions. What Jalokavacharana does is it serves as a clinical foundation for the entire healing process. So much like a jump start for a dead battery of your car or CPR to the non